Hi, hello everyone. Good morning, good afternoon, depending on where you are in the world. I'm delighted to be hosting this webinar. For those of you that I haven't met, I'm Tamar Ghosh, I'm Chief Exec here at RSTMH, and I'm here with my colleagues Alice and Eva, who you can probably see, who are part of the team and helping to deliver this webinar and helping all of you to be in the best possible position to apply for one of our early career grants. You'll notice that we don't have a grants manager at the moment, and so the three of us are kind of taking the role between us, and we'll be covering all of the questions. So we've got an hour with you today. I'm going to share my screen and take you through a short presentation in a minute, but just a few points before we get started. This is about the 2023 Early Career Grants Programme. If you have questions about the 2022 programme or 2021 programme or whatever, please do make sure that you email us about those questions separately, not in the chat today, but through info@rstmh.org, and we will try to answer those as best we can. Today is all about this year's programme and answering questions on that. So we have an agenda to follow. Hopefully you can see the screen okay. I'm going to tell you a bit about RSTMH to start with. I know that many of you will know RSTMH, but some won't. So I think it's really important that I have a chance to just tell you a little bit about us and what we do. Then we'll move on to the main business, which is to talk about the Early Career Grants Programme. Now I'll cover eligibility, and I'll share the form with you so you can have a look at the form if you've not seen it before. And I'll then cover the review process, a bit about that and the timeline. Then we're going to hear, which is really exciting, from one of our past awardees from 2020, who had a really interesting journey through through a few years and until achieving an award and delivering his project. And then we've got a chance just to cover off where you can get further information, and then we'll open the Q&A. So I'm hoping that we'll have finished talking, myself and the video we're going to show you from our past awardee by about 10:40, 10:45. So there will be chance for questions. Now the chat is disabled for attendees. We are able to post you things in the chat. So Eva and Alice will be sharing links with you on important things for you to know about. The Q&A is the function we want you to use for questions, but please wait until we get to that last point on the agenda before you post questions. The reason is we'll cover lots of these as we go through, and it will just be very difficult to answer other questions if they're already full. So do please try and hold off until we get to the Q&A section of the agenda, and hopefully we'll have covered everything you want to know by then anyway. All right, so a bit about RSTMH before I talk about the programme in particular. So we are a charity. We are a network, a membership body for people that are working in or interested in tropical medicine or global health. We were established long ago in 1907 and in the UK, and we still are based in the UK, in London. We have Royal Charter, and Her Majesty Princess Royal is an honorary fellow of the organisation. We have over 1,800 members currently. It's going up a little bit, which is lovely, in more than 100 countries. So our members are based in all areas of the world, and where the issues that we work on are really important. But outside of that network of 1,800 members, we also have around 20,000 researchers and professionals who are engaged with our work in some way or another. Now, that could be that they are authors or reviewers on our journals. They could be attending our meetings and events. They could be providing a reference to one of our grant awardees. We have a really strong network of people working in this area of work. And as a team, we're quite small. We're currently 6. We have 2 vacancies, so we're normally 8. And we're based in London, as I mentioned, but we have 1,000 volunteers that help us deliver the work we do. And that's how we are able to deliver so very much for everyone interested in this area of work and wanting to be part of our membership network. Those volunteers have roles on the journal, such as reviewers, editorial board members, associate editors, editors-in-chief. We have a board of trustees. We have 6 committees. We have global assessors who look at grant applications and abstracts for our events. And we also have ambassadors, student ambassadors and country ambassadors based in organisations and institutes around the world who help us by disseminating information about the society and also, importantly, advising us on what we should be doing differently. And that is about tackling issues that they see either within their country, if they're country ambassadors, or for student networks that they are engaged with if they're student ambassadors, and also about their institutes and also their countries. So our big goal, not surprisingly, and shared with many other NGOs, organisations, individuals, the most important goal for us, the top up there, is about saving lives. It's about eliminating, eradicating disease and improving equity and access to health across the world, and in particular in low resource settings. How do we do that? So in a minute, I'll tell you about our day-to-day activities, but how do we think that we have a chance of reaching these big aims? Well, in two ways, primarily. One, we help our members as much as we can. We fund them, we showcase them, we provide platforms for them to learn new skills, new expertise. We hopefully improve their networks of other collaborators around the world. And in many ways, we just try and make sure that their careers are as strong as they can be through our support. The second way there is about us calling for change that would achieve this big goal that I mentioned before. That might be a research gap that we identify. It might be a funding gap that's needed to be plugged. It might be a policy change. It might be awareness of a certain aspect of health, a certain disease potentially, that really needs a little bit more championing. And that's what we do. So how we do that? Well, it's partly through our members group. So their collective knowledge, their expertise advises us on what we should be doing to achieve these big goals. And also, as an organisation that's been around for some time in the sector, we have our own views and we have that information coming through our partnerships, our networks, and we use what we find out to try and make a difference on those big goals. So what do we do day to day? Well, there's a lot going on. And I'm sure you know about some of these, but just in case. So we have 2 peer-reviewed journals. Transactions has been going since 1908. It's published monthly and it's members. It's for members, unless you have access to that through the library or other institute that you're based at. International Health is available every 2 months and it's for everyone. It's fully open access. Now, Transactions is a bit more technical, a bit more clinical in its nature. International Health, a bit more policy focused. But between them, you know, we do have many of the big breakthroughs in global health and tropical medicine coming through scientific communities. We then have meetings and events that we put on around the world. Now, we're really, really pleased that since lockdown was lifted, we're able to do more outside of the UK. We've been trying to do events in other countries. So we've just, in the last few months, completed some events in India. We've also been to Thailand as part of a partner event. And this year, we're planning to hopefully be in Tanzania, possibly India again, and hopefully Nigeria. So as time goes on, we're trying to make sure that we are available to our members as much as we can be, whether that's in person or now more than ever also online and accessible through virtual networks like this. If you're a member of RSTMH, there are discounts for all of our meetings and events. Now, we'll go on to talk lots more about our early career grants, but I'm sure you know a bit about them. They're there for anyone to apply for. You don't have to be a member to apply for an early career grant with us. If you do win, if you become an awardee, then your membership fee will either be donated from one of our very, very generous donors. I'll talk a bit about them a bit later on, or it will be deducted from your grant award. So you don't have to worry about membership. Membership will be provided for all awardees. And that's because so much of our benefits and our values are for members. And so therefore you need to be part of that inner circle to benefit from those things. Okay, moving on, we give out travel scholarships to attend our own events. We'll be announcing information about those later this month or into next month, and they are prioritised for our members, particularly members who haven't travelled to international events before, and they have the chance to do that for the first time, improve their networks, have some mentorship and other opportunities. We give out medals and awards every year to celebrate success. Now, that could be emerging leaders, it could be people at mid-career level, or it could be at the height of their career. super senior level. They are for members generally. Many of them you can self-nominate, some of them you have to be nominated for. And if you're in that position, please do check out the website and see if you can either nominate yourself or someone else to achieve one of those medals and awards. For our members as well, we deliver mentorship and training. We're doing a bit more of that as time goes on. We've been doing that through our events mostly, but we are looking to try and increase the amount of guidance and mentorship that we can provide. We are just starting a new 5-year strategy this year, and so that does mean that we're going to be starting some new activities. So do watch this space for more information, either the newsletter, or if you're a member, then you'll get other updates as well. Just a few more things to mention of what we do. We have a membership directory if you're a member and sign into the website, and through that you can find other people who work in your area of disease or health, also location and some other factors. So that's a really good way of growing your network, by finding people who might be like-minded in terms of your particular area of work. And we also have a members area, which is where we populate lots of information around guidance and webinars, things like this, blogs and other content that might be really interesting for our members. And then I'll go to the last point on there. We have a website called growglobal.health. Now, this is where we've brought together courses, funds, jobs, PhDs, and all sorts of other placements that are available globally for those interested. This is not a members only site. So please, if you haven't looked at that yet and you have an idea of finding out about new opportunities, do have a look at that. Okay, so that's the introduction about RSTMH. To move on to the important parts of the Early Career Grants Programme. So I've got a few slides on this. I'm going to take you through. This first one is almost like a summary, and then I'm going to move on to look in more detail at eligibility. So first of all, just to take you through the core elements of the Early Career Grants Programme, it's for those that are working in or studying tropical medicine or global health. I'll come on to define early career because I know that people define that very differently in different places. The grants that we give out are up to £5,000 each, and they're for projects which last up to 1 year. Now, we do put some criteria on this, and if you think about, I suppose, the top end of experience, if you've had research funding in your own name of £5,000 or more, or equivalent in dollars or euros or other currencies, then you're not eligible. You're too experienced for this particular grants programme. This is aimed for people that have not had research funding in their own name of £5,000 or more. Just a bit about the actual programme itself. It's been running for many years. Around 4 years ago, we started to really invest a bit more time into marketing and into the process for applications. And also we were able to recruit some donors who helped us by providing more income so we could provide more grants. Now, this has been a really great success story of the Society. About 4 years ago, you had probably a chance of 1 in 39 of being awarded. Last year, that was 1 in 10. So it's much better odds now for you. So do consider applying if you're in the position and once I've gone through all of the eligibility. So just to bring that to light, in 2022, we received 1,914 applications, and we've awarded so far 202 grants. Now, we are talking to one of our partners in India, and we may be able to award another 5. So I'm hoping we'll get to 207, but it's a really great number and we're really delighted about it. In terms of who's eligible or how the kind of programme sits in terms of scope, you can be of any nationality, based in any country in the world. You can be in any discipline or sector. So you don't have to be a clinical academic. You don't have to be a medic. You don't have to be, in a particular role, a particular stage of your career. If you are working in tropical medicine or global health, you can apply. So we have every year many different types of individuals applying, students, at all levels of degree. We have many different people working in health directly, doctors, nurses, vets, community health workers, many different areas of work. And we have many in social sciences who are working in global health problems and wanting to take on an issue in global health and do some work on it. So don't feel that the discipline that you're in should be a barrier to applying. Similarly, the projects that we fund are very broad in nature. They can be anything from a lab-based study, they can be translation, they can be implementation in the field, they can be patient pathways, behavioural change projects, education for communities, or policy. So really, really broad. And I think that's one of the main advantages perhaps of this programme. We really want to fund as many people as we can who are at the start of their research careers and have great ideas and want to take them forward. And that's really what drives us, the idea of everyone having this opportunity and seeing where it takes them in their career. Because they are generally the first applications that people do, we've tried to make it as easy as possible in terms of the application process and also in terms of the reporting process. So we hope that the application form will be easy to follow and easy to fill out. So I want to spend just a little bit of time on the early career definition, because as I mentioned, I know that many other organisations have very different views of what early career means. So for us, we have not adopted an age-based rule or qualification based rule for simple reasons that we know that we want to encourage as many people as possible to take part in our grants programme. And it's not so simple these days of using ages or career stages, because we want people from many different roles within global health. They may not have the same qualifications, they may be moving careers, and they may not be at a certain age bracket. So, and there are many reasons for career breaks and changes. So for those reasons, we don't use age or qualification. We use these two things, which you can see on this slide now. At the top end, you can't be experienced enough that you've had this research funding in your name of £5,000 or more, or equivalent in other currencies. However, you should be experienced enough to be able to do the things at the bottom of the screen. So you should be able to carry out research under supervision. You should have the ambition to develop knowledge of research methodologies and disciplines. You will have to demonstrate those as part of your application form. You should have a good understanding of your field of study, how you feel it's going to make a difference, because these are the sorts of things that will be tested and assessed as part of the process. You should be able to produce data under supervision, to analyse that critically, evaluate that, and from that, I guess, you're moving through to outputs and outcomes, and you should be able to explain those and the value of those as part of your work. So that's how we define early careers. Moving on, we've got a few slides on eligibility now. So the first point at the top there, we know that not everyone starts research when they start their career. So although we say you should be early in your career as a researcher or professional, we do understand that some people may have done very different roles in global health for some years, or potentially outside of our community altogether, and maybe coming into the community quite late in their career and starting research for the first time. They're not excluded from being part of the grants programme. So if you fall into that category, please do apply as normal. If you've been declined as an applicant from one of our grants, you can still apply again. There's no barrier to the number of times you might want to do that. It's completely up to you. If you've received from us a travel grant or student essay prize, or you've had a prize at one of our events from being best poster, best presenter, you can still apply. So those are not negating your application for this process. If you are a student, you are able to apply, whether you're undergrad, postgrad, PhD, that's absolutely fine. You can apply. You just can't use the grant to fund any tuition fees. They have to, these grants are for projects that you're delivering. So they're the areas of your work that you could have funding for if you're a student. You do need to have a personal bank account. This is very important. Our grant programme is for individuals. It's not for institutions. It's not for groups. It's not for pairs of researchers. It's for individuals. And the assessment that your form goes through is partly about you as a person, as well as your project. It's about how this will benefit you and your career personally. The grant payments are also provided to you directly. They're not for your institution. I know that that's quite different to other grant programs, and it's really important that you are aware of that, because if you don't have a personal bank account, we are unlikely to be able to fund you. In fact, you would be ineligible. Now, there are small exceptions to this. If your government, where you're based, prohibits you having your own payment, then we can talk to you about it, but only if it's a regulatory issue would we go against that principle. So do make sure that if you get through the process, you have a personal bank account in your own name. Then secondly, on that point, you need to be working for an organisation. This is because one of your references needs to be from a senior person within your organisation. So although the money is not flowing to them, they do need to be partly responsible to make sure that you have the infrastructure around you to be able to deliver your project. So you do need to be working at an organisation. If there is a reason why you're not, please don't ask the team. We won't be able to give you an answer. Please put it in your form. Make your application as normal and make your statement in your form. There are areas where you can put information about things like this to explain why you may not be at an organisation at that time. And it's down to the assessors to see if you would still be eligible or not. Okay, so you would need contact details. So this seems, maybe this seems a bit basic, but it's very important that we can contact you throughout the term of the application process and award if you're lucky enough. So that's about 2 years. So you need to make sure that you have an email that will be running for 2 years. If you're in an institute and your email address is going to stop when you graduate or whatever, please don't use that one. Please use one that is going to be available for longer so that we can make sure that we can contact you. And also you need to have a supervisor who will be with you for the duration of this time as well, the 2 years. So choose them wisely, make sure that they're committed and that they will support you. And just to say, they will be, you'll have to note them on your application form and they'll have to provide a reference by the deadline. It's your responsibility to make sure that you chase them and you know when they've submitted their application reference. It has to be in by the deadline, otherwise your form will not be eligible. Secondly, you need to have, as I mentioned, a senior member from your organisation also submitting a reference, and similarly that has to be by the deadline. And sadly, there are no exceptions made if there are not 2 references on the form by the deadline time of 9 AM on the 28th of April. The form needs to be in English and you need to be able to start your project between September and December 2023. Now, this is really important because if you know now that you won't be able to, perhaps you know that you'll be doing a secondment or you'll be unavailable to do a field piece, the field work that you might have planned, or you'll be on maternity leave or you'll be on extended leave, whatever it is. If you know you can't start your project, please don't apply this year. This is about trying to get as many people through fast projects as we can. And if you won't be able to start in that period of time, you must wait until the next year so that someone else can have a chance of starting earlier and completing their project. All right, so hopefully this slide will also answer some questions about eligibility for you. So these are things that would rule you out of the grants programme. If you have received an award from us, an early career grant, even if it's less than £5,000, you can't, you won't be awarded again. So please don't apply. This is because we want to help as many individuals as possible, 1 early career grant per person. If you are a supervisor on another RSTMH early career grant project at the moment, then please don't apply because you can't be a supervisor on a project and be an awardee at the same time. If you have questions on that, please do ask us afterwards. It's 1 application per person per year, so please don't submit 2. If you do, 1 will be discounted. This is for individuals, as I've mentioned. So if you're part of a pair in terms of your research, if you're part of a research group or an institution, you can't apply collectively. This is about you as an individual. So just please bear that in mind. And global assessors can't apply in the years when they're reviewing applications. Funding for projects cannot be those that have been started or completed already. No retrospective studies for this grants programme. It's for projects that have not started yet and will start later in the year. Once you've been awarded, because your assessment is based on exactly what you've laid down in your form, where you will do your study, how you will do your study, and when you will do your study, they are the only criteria on which we will be awarding the grant. If you want to change any of those things, the likelihood is you'll need to refund and reapply. We can't change any of those things after you've been awarded because that's not the basis of your assessment. So You must be very clear in thinking through how you will conduct your project and make sure that you will be able to do it in the way you would like to, in the timings you would like to, before you submit your application. Similarly, as I've mentioned before, lots of times it's about you as an individual, so you can't transfer the grant to anyone else or to your institution. It is just for you. The team at RSTMH can provide 2 lots of 3-month extensions to grants, but they have to be for very good reason. The most frequent one that we hear of, and we've heard of in the last few years, as you will imagine, is linked to COVID. So COVID has delayed access to labs, access to communities for studies, and therefore we have provided extensions. But it's very, very, very unlikely you'll get an extension without good reason, and also that you'll get more than 6 months. So we would then ask you to refund that grant so someone else can take part in the programme, and you may be able to apply at a later date. Okay, scope of the grants. So the projects can be clinical or scientific, they can be field work, they can be lab-based, as I've mentioned, they can be standalone projects, they can also be parts of a larger project. In terms of the disease or the health area, so we're looking at any disease, any health area, which is within tropical medicine or global health, that affects low resource settings. I've put a list here, but this is not a definitive list. If you don't see your area on this list, please don't think it's not eligible. Just please focus on the fact that it's a disease or health area that affects low resource settings. Again, the team aren't the ones to advise you of the technical nature of your project. If you have an area and you're not sure whether the scope of it is right or not in terms of the disease that you're focused on or the area of health, the advice is always going to be to apply and let the assessors look at it. We're not qualified to decide whether aspects, particular projects are in or out of scope. And the assessors will look not just at the area of work that you're focusing on, but also the project in the whole. So we'd be in a bad position to make that decision because we don't assess your applications. It's done by a group of independent assessors. Okay, we're on to the application form. And I just noticed I have an error because I want to show you this and I want to show you the form. Let me work through the slides with you, and then what we might be able to do is post something in the chat or have something available on the website, which is a PDF of the form so you can actually see it. But please bear in mind, these are some of the headings that you would see on the form. And so hopefully this is a really good insight into what the form looks like. Now, when you first go onto the form, you'll notice it gathers personal information, your name, your email address, your address, contact details like your phone number. It will ask for your gender, it will ask for your nationality and where you're based in the world. These are so that we can match your application to our donors, and also so we are aware of how diverse the programme is in terms of location, in terms of gender, in terms of disease area, and so on. So I'm not covering all of the kind of personal information unless it's important to this. So membership, we've mentioned, you don't have to be a member to apply. And if you are awarded, you will have your fees paid for or deducted. Your personal email address, is really important because it needs to be the one that's valid for 2 years, as I've mentioned. I've covered employing organisation. Again, if you're not employed, you need to provide information on the form that the assessors can look at. And again, we won't be able to answer questions on that. Now that is for the assessors to do. There is a field on the form which asks you about your professional recognition and your key achievements. And this is really great for you to tell us about. It really helps the assessors to get a feel for your career so far, what stage you're at, and how this will benefit you. So do make sure you list all of those things in the part of the form. Now, there's a section on early career researcher, and I've taken you through the criteria for that we use. And from the assessor's perspective, they're looking at your form, they're looking at what role you're doing, what your qualifications have been so far, what you've achieved so far, and then making an assessment based on that as to whether they believe you are early in your career. Now, you will get a chance to make your point on this as well, and you'll be able to say why you feel your early career, and if there are particular unique things about your experience, then you can bring those to light for the assessor to consider. You'll be asked for a title for your project, which needs to be 20 words or less. And that is really important, that it makes sense to someone who's not working in your field of work. So try and make that as simple as you can, and that is the way that your project will be described when we're talking to donors, when we're making assessments. We ask you to write a few words on the disease or the main health area. Now, what we're looking for is 1 or 2 words, no sentences. This is the way we match you to assessors, to make sure that someone who understands your area of work can be the best person to look at your application. So, for example, the word malaria or climate change or diabetes or whatever it might be, that's all we want, as small as possible. Moving on from that, that keyword, you will be asked to give a very simple description of your project, 100 words only. This is a really great part of the form for everyone, for assessors, for us. It's the way that we get to understand your project. It's likely that, as we won't be experts in your field of work, and therefore you need to explain to us so that we can really understand what projects are applications this year. So make sure that you make that as simple as possible. And I would advise, as I will with other parts of the form, that you show someone else before you submit those. And I should mention that application forms are are submitted through a platform. It's called Submittable. You'll see the link to it on the website. Now, Submittable is a form which you populate with all of your answers. You can save as you go and come back to it, but our recommendation, because you never know with technology, and if you lose your connection at a really crucial time, we would recommend that you write out the big important areas of your form offline, get them right, have someone look at them and help you, and then transfer them onto the submittable form before you submit. Of course, you can approach that any way you would like, but this is one of the areas where I think having someone look at it is really important to make sure that it does make sense. Now, you would input your project start and end date. Bear in mind that you need to start your project before December 2023. If you can't, and you've got start dates into 2024, you probably won't be eligible. And you should be showing an end date of within a year of starting. So again, that's really important for eligibility. We have a question in there about laboratory use. So that's because one of our donors favours studies which have minimal amounts of laboratory study as part of the project. That's only one of our donors, but for that reason we need to capture this information so that we can understand whether which donors the criteria suits. Now we're on to the more detailed project statement. This is your big parts of the application process where you're writing 1,500 words about your project. Now, you'll see if you have a look at the PDF, which we'll post on the website as a link, you'll see that this is a really important part of the process, because this is where you have to give us, in your own words, the journey of your project. So if I start at the beginning, you'll have an issue or a problem that you're trying to address, and you're translating that into a research question. That's how you will be describing that as part of your detailed project statement. You'll then need to talk a bit about what your aims are and what your research question is, and really define it. So whether that's a question, whether it's a hypothesis, you need to make that really clear in your project statement. They will then be asked to write something within this 1,500 words about the design. So how are you going to approach this research question or hypothesis? What methods will you adopt? Quantitative, qualitative? Which kind of studies will you do? What numbers will you involve? All of the things around your methodology need to be very, very clear for assessors to read through. And this is really giving them the chance to understand how you're going to produce the data at the end of your project, which helps you then determine your outcomes and the findings that you feel you've made. So it moves on in the 1,500 words then to cover the approach you're going to make, what your outcomes will be, and how you're going to disseminate them, what you will do with them once you have them. It also asks you to be very clear about your role in the project. Now, not to repeat it too many times, this is about you and you as an individual doing your project. This is what the assessors want to see, that this is you taking the lead for the first time in your project. If you're not involved in this project, it probably won't be awarded because it probably isn't a personal grant for you. Okay, moving on then, there's a reference section where you can upload around 1,000 words of references that will be supporting your project statement. So supporting the need for this piece of work and how you're going to do it. Following on from that, there's a project budget area of the form. And this is about you saying the total amount your budget will be. Now, please check this number carefully. If we have budgets that don't add up and we don't have the time to check them with you, we will just decline them. Please make sure that when you put your budget together, it adds up to the total you put in the total box. Beneath the total box, you'll be asked to give us a very detailed breakdown of the budget. And I need to stress, this is a reason why some people do get declined every year, because it's not detailed enough. You need to describe each item of budget. So X number of consumables, what they are, what the amount is, and that may be per unit or it may be the total amount, and why that's important for your project. The more detail you can put in your budget, the more chances are the assessor will understand how this particular budget is going to fund this particular project. Please make sure that you refer to the eligible and ineligible costs, which are in the terms and conditions. They're on the website, and you can have a look through all the things that we are able and we aren't able to fund as part of the budgets. And it may be that we need to ask you to remove something, or that we just decline you because your budget is not an eligible budget. Now, within the form, you're also asked to put in the progress stages of your research. So every quarter from 2024, you will ask to be, will ask you how you're going. How is it progressing? Are you at the milestones you thought? And if not, what do we need to do to help you? So make sure that you've got an idea of how your project will play out over the course of that year. Okay. So now we're on to just looking at the review process, and this is fairly brief before we hear from our past awardee. So just a few things to say. You need to, your application will be looked at by at least 2 assessors, sometimes 3, depending on what they both say about your application. And they will be the people that decide whether your application is suitable for a grant. Now, they are from a wide range of disciplines, including medicine, and I've listed a few there, academic research, health economics, and all sorts of other areas. And they really are experts in their fields, and they look at many applications every year, so they have a really good understanding of the process and try, if they can, to make sure that as many people as possible go through to be awarded. What they tell us about the common issues why people don't get awarded or don't get scored highly, they can tell when applications are rushed, so to please make sure you take your time. Every year, we get the bulk of our applications in the last week of the deadline period, and that is something that assessors say that they can tell. So make sure that you start early and you have time to complete it properly. Some applications are incomplete in that they've started to write something and then it's cut off. They haven't had time to finish it, or they've not realized it's not finished. If it's rushed, then obviously it can be difficult to maybe understand some sentences. There can be grammar that's not accurate. It can be difficult to follow. The research question might not actually be linked to the issue that they've said. So make sure that the flow of your project is making sense. The methodology doesn't seem to be right. It's not going to be delivering what they say. The outputs aren't right. They're not going to be delivering what's said. The budget may not be feasible. There are many reasons why assessors tell us that they feel that applications are not high quality. And these are included in the terms and conditions. These are the criteria on which they base their formal assessment of your application. So the importance of your research, the quality of the methodology and the design, how feasible it is to be carried out within the timescale in the ways you've said, the impact of this on the bigger community, the wider community, the availability of your of support, and the value for money, so looking at the budget. And just to stress, we don't provide feedback on our applications. This is because our global assessors do as many applications as they can, and to be able to provide feedback which is detailed enough to help you would mean that they can't look at as many applications. So we made a decision some time ago that we're not able to provide feedback. If feedback is really important to you, please don't apply, because we won't be able to provide it. There are many reasons why, we know that people don't get through. The common things are mentioned above. but we won't be able to give you feedback on your particular application and why it wasn't successful. Okay, now I'm going to stop sharing my screen and we're going to show you a video from our past awardee. So this is Nkamengo Francis Nongley, who was an awardee in 2020. Enjoy.
I am Nkamengo Francis, currently based in Cameroon, and I'm a terminal PhD student or terminal PhD candidate at the University of Buea, and I'm doing part of my research at the Center for Research in Infectious Diseases in Yaoundé, Cameroon. Yeah, so I am also an RSTMH NIHR Early Career Grant awardee, wherein I focus my research on malaria and schistosomiasis co-infection. So I think based on this exercise, the first question or the key point I really want to tackle is, why did I decide to apply for the RSTMH? And again, just to say that I started the career with the RSTMH in 2018. So I actually submitted my first grant proposal, which was not successful. I tried again in 2019, it was not successful. But then 2020 was actually a game changer, because what really really inspired me to apply for the RSTMH was impact. I think that is just a simple word, impact. And I was looking at impact with respect to 4 main points. So the first is career and skill. I like to build my impact in career and skill development. And the second aspect was to why also getting this skill to also support skill transfer, by building capacity development for younger scientists as well. So that was my second point with respect to the wider vision of impact. And the third was like, what is the policy implication of my research, of my key questions, what I'm like going to do. And lastly was the managerial impact. That is very, very much more important if you want to continue in the ladder of academics and research, to be able to show proof that you've actually managed a small budget before. So I think those were my 4 main points with respect to the broader vision of impact, which really motivated me to apply for one of the RSTMH grants. And the second point is like, how do you decide on your research area? And I think this is a key point for these grants, because it's actually very competitive in nature. You have a very diverse array of ideas from, of course, senior scientists, junior scientists in various phases of the careers. But then defining key parameters, with respect to your research goals, helps you ensure that your objectives tailor to your outcome. There is a very beautiful, I think a very beautiful acronym that is always used, called the SMART objective outline. So SMART, actually, the S stands for specific. So one of my mentors told me that always write down your ideas, irrespective of where you are. Always work with a pen and a paper, and that has taken me throughout my career. Wherever I am, I always have either a pen or a paper on my phone. Immediately as I have an idea, I just write it down. So write the goal of the project you have in your mind, but more specifically, what do you want to accomplish? So that is the specific nature of the objective. The second is M, and like the second word is M, which stands for measurable. So here is how can you measure, the progress, of your objectives, and how can you meet your goals. So your objective need to be measurable. So you must have some key points, some key the deliverables that you should be able to quantify. So the objectives has to be quantifiable. It has to be measurable. And the third one is the achievable. So which is, do you have the skills to achieve this? And most of the times, from my basic experience in, let's say, reviewing grants, and I've really looked through that. Sometimes most applicants don't have the skills. So the first aspect there is, you really, I mean, like when they apply, you get your name, search online to see if let's say they've published something on that, or to see what they've been doing. Like they really have no skills on that, and you can clearly see from their proposal outcome, which is not really coherent. And of course, you can judge that, okay, they don't have the skills to let's say do this research and to come up with quantifiable outcomes. And the fourth one is relevant. So here is the goal answering a specific health concern, So yes, I think the objective needs to target a problem of public health. So of course, RSTMH grants, I mean, are tended towards health. I mean, they are like health related aspects. So your project needs to focus on a public health aspect, and then this can really show the burden, like the weight of that problem, and it can really give an overview if what you are going to do will really have a significant outcome. Yeah, and the last one is time bound, and this is very, very much critical, particularly for early career research, because the concept of time bound goes with the amount of funding, and also the objectives you set out for yourself. And it like all downstreams to one key point: don't be over ambitious, because of course, I always feel that people have very beautiful ideas out there, but sometimes they are very over ambitious, such that like, oh, we want to do everything within a very streamlined budget. And of course, yeah, the proposals are beautiful, but when you compare the budget with what the applicant wants to do, it does not tie. And I mean, like, so it really has to be time bound. So the schematic format was what actually guided me through my failures from 2018, right down to where I actually got the grant. Yeah, and like I've also learned to always take failures as a stepping stone to rebound for success. Yeah. So and the third point is what were the most challenging parts of the form and how did you manage them? So the most challenging part of the form was my rationale. Yeah, and I think for most grants, this is the most challenging part of the application system, the rationale. So your rationale has to again follow the SMART objectives, So your rationale has to bring out a clear story, it has to be a story. So you bring out a clear story, what is this disease about? Secondly, the burden, like how many people are affected, and you have to link how your research questions. So what questions are you setting out, to address, the problem? And so that was my most challenging aspect. Yeah, and I got to overcome this by always trying to focus my work. So I should not be too generalized, but actually bring it down to a specific focus. And the fourth aspect is, what are your tips for applicants this year? So I think the major tip is your idea must excite you. So if your idea does not excite you, there's a high chance that the idea won't pass. It should be coherent. You should have a systematic flow of ideas, and it should be innovative. And always try to share your ideas with colleagues and peers to comment and make feedback. Okay, that's fine for me. Thank you.
I did know, but I'd forgotten it, that you'd done it twice before you're successful.
Yeah, actually.
And it's interesting, actually. Were there big significant differences between how you approached it in 2018 and 2020? Because obviously we don't give feedback, which is often difficult for people, but we can't because of the numbers we have. But yeah, what was that change then?
Yeah. So I think in 2018 and 2019, I was not experienced actually. So I was like really so diverse, you want to tackle all diseases, So I think that until you should really follow your path. So I had some really good training in neglected tropical disease and malaria. So I really built on that platform to really be so much specific to my idea.
Oh, amazing. Good. Well, thank you. Okay, I hope that was useful. I've just got a couple of slides before we open for questions. I know that myself, Alice and Eva have been frantically typing to try and get some of the questions answered as many as we can. And I've put a few for answering live as well. But before we get to that point, just a bit on the timeline. So I know you'll have seen this because it's on the website, but just in case, we are open now. We've been open for a couple of weeks. We are closing on the 28th of April at 9 a.m. BST. That is a really important time to note, because if your application is not submitted with your 2 references at that exact time, it will be declined. So do please make sure that if you are submitting an application, you are in touch with your references personally. You know that they are aware of what they need to do, and they have the link. So when you put them into Submittable as part of your form, they will be emailed from Submittable with their own unique link to upload their reference. We can't upload them, you can't upload them, they have to upload them through this one link that they get to their email addresses, and they have to do that by the deadline. So I can't stress that enough. You need to take responsibility for being in contact with them and making sure they've done that. We will aim to make funding payments around about September. Now, this is difficult to be guaranteed on because we never know how many applications we're going to get. So it's very difficult to know whether that will be feasible or not, but that's our aim. We want the projects to start at the latest by December 2023. They have a year, and then reports are due by March 2025. As I've mentioned, if you don't think you can work to those timings, please don't apply, because you will be stopping someone else from having a grant this year. Okay, before we move on to the last few minutes of Q&A, I just wanted to mention some items for further information before we take them. If you go onto the grants page of our website, which I'm sure you have, you'll see the T's and C's and the FAQs, and this recording will be there as soon as we can get it up. We are also putting up this year some case studies of very good applications, so you can get a feel for why they might have scored very well in the programme before. They'll be up within a few weeks. Do watch this space for those coming. If you're a member of RSTMH, we are running guided sessions on areas of the application process in more detail than I can do today. So I'll be looking at the budget in much more detail, the methodology, how you get your research question written, those sorts of things. This is for members only, and we'll be providing more guidance there. If you're not a member of RSTMH, obviously you can find out about everything we do, or most things, through the website or through our newsletter. The sign up for that, I'm sure, will be going into the chat if not already. If you want to join RSTMH, we can offer a 10% discount for everyone that's attended today, and that means you can access more information, more support for the process. But just to stress, you don't have to be a member to apply. And if you have a question after today that we haven't answered, please go to or send it to info@rstmh.org. That is just because we don't have a grants manager. So we're going to be managing that inbox between a few of us, making sure that we can respond as quickly as possible. So that's the easiest way for you to get a response. Okay, so presentation over. I'm just going to work through some of the questions in the last few minutes that I think would help one or a number of people. So the first one I wanted to put in this area is about employment. And that, sorry, not employment, this is about, it's from someone anonymous. It's about defining projects that have not started. New data collection. Okay, so what this is about is you can't have funding for a project that's already underway or that's already been finished and retrospectively funded. This is about a project that you're about to start in a few months' time from scratch. Now, that doesn't mean that if there's a big program going on in your institute that's been going on for some time, and you can join in with that and start something new in September to December with a new data set and a new piece of work, that's absolutely fine. But if it's already underway and you're being part of something that's already decided, then that's not for our grants program. So that one is hopefully answered. And then there's a question about employment. So as I mentioned, you should be employed for the grants program because you need a senior person from your organization. If you're not, if you're a consultant, or if you're not employed in a kind of traditional way, if you like, then that question is not for us, but it's for the assessors. So in that part of the form, explain your circumstances. If you're a consultant, for example, explain who will be the equivalent of that senior individual that will help provide a reference for you about your project. So that can be someone else that you're maybe collaborating with, or someone else in another organization, but you need to have thought through how you will justify that second reference. There are lots of questions on PhDs coming through, and we do get this quite a lot. So it can't, the grant can't fund tuition fees on PhDs, but it can fund research studies which are part of PhDs, or part of master's programs, or part of undergraduate programs. So I would refer you to the T's and C's and the budget eligibility so that you can see which costs you're allowed to include and which you can't. And that will really help you to understand where that line is. Okay, I need more information on what you mean by health area of tropical medicine. Yes, good point. So this is from Emmanuel. So what we mean by that is we know that some projects are not disease focused necessarily. They might be around climate change, the impact of climate change on health in a community. For example, they might be on the built environment, they might be on disability, they might be on vector control programs. They're not on a particular disease. So that's what we mean by health area. So that one's done. I'm just working through so I can get through any others before we finish. Okay, this is a really good one from David on, and there was another one I saw earlier on about secondary data. The grants aren't for you to sit and do desk research. That's not the purpose of them. The purpose is for you to undertake a study of your own, which involves some element of primary research. So that might be field-based, it might be lab-based, it might be community-based, but it wouldn't be you doing a systematic review at your desk. Unfortunately, that wouldn't be eligible. If you have a look at the eligible costs, you'll see that, because you can't just have a fund which is funding a salary. You can't just have a grant which is just funding travel. It is about delivering a project from start to finish, and that's about primary research. So that one is done. I know there are others. So Florence, co-investigators, the grant is for you as an individual, and therefore no one else can be named on the proposal. And so no, formally, no, this is just for one person. The support that you rely on to conduct your research is up to you, but the funding is for you to deliver the project yourself. So I hope that answers the question. Okay, so Vinesh, about the 1,500 word project statements. I'm sorry I couldn't share two things at once today. That was a shame, but we will try and find a way to get a PDF of the form onto the website in some way, so you can at least see the form before you go on and start to fill it out. But to answer your question, the form where it asks you for your project statement, it gives you clues as to the headings that you should put in. So, and I read those out on a bit earlier. So one is around the methodology you will adopt. There's one about the context and why you're doing it and how this will address the issue. There's one about the outcomes you should get. There's one about what you'll be doing specifically yourself, how you're going to disseminate. So it gives you the headings that you need to follow as you work through that statement. The recording of the webinar will be available on the website as soon as we can make it available. I'm not sure we would be able to email it because it will be too big, and that's to Abdul Muhiz. So hopefully, and it will be up for many weeks, so hopefully you'll be able to access it at some point when you've got the right bandwidth available. Samuel's question about your role. So this is about what you're physically doing in the project. So we would expect that the person on the grant application is leading the whole project from start to finish. That doesn't mean that they may not need to employ the time of community health workers, of lab technicians and so on, but we need to understand what you'll be physically doing as part of your role. It wouldn't be eligible as part of the programme if you were to receive the grant, but then you're passing it on to somebody else to do, because as I've mentioned, the assessment is about you and how this will benefit you personally. Yes, you can have a supervisor from another country. It doesn't matter where they're based. I hope that helps. And to Christopher's point, just the last minute or so, the references have a 1,000 word limit. So you can put references up to 1,000 words in the application. Okay, so we are now at time, and I know that time is precious for everybody, so we're going to stop there. Please do, as I mentioned, have a look at the terms and conditions. Many of the questions that I can see in the Q&A are covered by the terms and conditions and by the FAQs. So please do have a look at those first. If you can't find the answers for those, then do please then do please email info@rstmh.org and we can try and answer them for you. But bear in mind that there are some things that the team just cannot answer. It's down to the assessors. And so what we'll be doing is asking you to make your application, justify anything that might be different to what's expected, and let them make the decision. So thank you so much for attending today. It's been really lovely to have this chance to talk to you about the Early Career Grants Programme 2023. We hope that you'll apply. Good luck. And as I mentioned, if you did want to get the further guidance as a member, then do please email Eva, and I think she's put her email address in the chat, so you can email her about that discount that we mentioned, the 10% discount. Okay, well, I'll say goodbye. Thank you so much, and good luck with your applications. See you.